Hi, I'm Dr. Mendoza. Very thrilled today to be here with my very close friend, Stephanie Farias. I'm an internist and also an integrative practitioner, and decided to do these informational interviews to get some more recognition out there to integrative medicine practice. And what better way to do it than having a conversation about it with a dear friend? Stephanie, why don't you tell us a little bit about yourself?
Sure. I am Stephanie Farias, and I am a realtor that serves San Antonio, New Braunfels, and Seguin. Dr. Mendoza and I have known each other since we were teenagers, so it's been a very long time. I think one of the things that both of us are interested in is the entrepreneurial approach. She's a business owner as well as a physician. And with real estate, I'm really focused on marketing and getting houses bought and sold. I do like to make sure that all of my clients really make the most practical, prudent choices for themselves, because real estate definitely is not a one size fits all. And I think that's your approach in medicine.
Absolutely.
Which is why I really think that this talk is helpful for people to get that. Not everybody has that approach.
Exactly. And coming from a very traditional medicine background, internal medicine is typically the care of advanced and chronic illness. And it was great. I loved it. I always had a passion for taking care of extremely sick patients. But what I started to realize along my career and along the way is it's also very rewarding to try to get in front of that chronic illness before it sets in, so that we can all live longer and age gracefully. So being proactive in my approach to medicine is what I'm choosing to do in the second half of my career. And I know Steph to be a very proactive individual in making sure people get their needs met. So we have that commonality. Not only do we share that, but we share a near 40-year friendship.
Yes.
That I really do consider you, Steffi, more like my family than just a close friend.
Absolutely. I do really like what you're saying about getting in front of it, because to me, it seems like these days, even if people don't take very good care of themselves, everybody is living longer. And so your approach, I think, is really necessary to take off, because I'm dealing with a mother who has dementia. Could something have been done differently, diet wise, hormone wise, or something along those lines, in order to have maybe prevented it or slowed it down?
Absolutely. And that's my whole model at Vitality MD, to try to prevent these chronic illnesses before they blossom. Because although, yes, we are so advanced in the medical care that we can provide, it's often a very tough course to treat illnesses, and not only hard on the individual suffering from the illness, but the family members associated as well.
Oh, I get that.
I know you do. So I've got some questions that I'd like to throw out there for you, and then I'd love it if you ask me some questions as well.
Absolutely.
Okay. So, Steffi, have you had any experience with hormonal imbalance personally?
Oh my gosh, yes, I definitely have. And it's something I'm still continuing to iron out with a local physician here. I think the hormonal imbalance was so significant, especially I did have a hysterectomy a few years ago. And since having that, it's been really difficult to regulate some of my hormones. And I know you and I have visited about what I'm taking and what I probably should be taking, although my primary disagrees. So I'm trying to work around that and get some hormonal issues taken care of.
Oh, yeah. So many women suffer after going through the hysterectomy. I don't think we do enough justice to women letting people know that this is a life changing surgery that you will not recover from in 6 to 8 weeks. You might be ready to go back to work at that time, but certainly the body needs so much more time to recover from the loss of the uterus and the ovaries and being thrown into menopause so abruptly.
And I think you're completely right. I have to be honest with you. My surgeon was fantastic. I did have some complications because of some other health issues. So it took twice the amount of time than a normal hysterectomy. And there were a lot more laparoscopic incisions. But I do remember having the conversation with you when I went to see him, I guess 3 weeks later. I asked him, when can I go back to the gym? And he said, I'm not going to tell you you can't go to the gym. And you specifically said, this is a life altering operation. Like, give yourself time and grace. And I do have a friend who is about to undergo the same surgery. And I gave her that same advice, like, just take care of yourself and let yourself rest.
I think you nailed it when you said give yourself grace. It's like women, we tend to be so hard on ourselves and think we have to get up and go and we got to jump right back in. And to a certain extent, we do, especially if we're business owners and we have small children or, teenagers, stuff like that. But to just remind women to give themselves that grace period that they truly deserve, because it's a major change. The body will never quite be the same.
No.
And you did share with me briefly that there's some concern over hormonal therapy, or that the primary care doesn't agree. What are your concerns about hormonal therapy?
So some of my concerns, I know he did indicate that I needed more testosterone in my system. I am currently taking estrogen, but I did ask about progesterone because many women have said that they absolutely need that. And his response was, well, since your ovaries were taken out as well, you don't need that. So right now I'm in the process of researching practices that do the testosterone therapy because his practice can no longer do it in office. So when I find a practice who can do that, I'll be asking them about the progesterone, like adding that in and doing some blood work or what have you.
Makes sense. Now, some people don't need the progesterone component, but the vast majority of the patients really do need that progesterone component. We have to think of the hormones as partners, and estrogen and progesterone are definitely partners, even if the ovaries have been removed. I always tell people, think of progesterone as the relaxation hormone, and estrogen is kind of the stimulating hormone. So giving someone estrogen post-hysterectomy, even if everything is gone, you still might hear patients complaining that I can't sleep, or, I feel agitated. And it's often because it's missing that partner hormone to achieve a balance. The other important issue with just giving estrogen is some of us have the tendency to make too much estrone, which is an estrogen metabolite. Some women don't make it at all. It really is a genetic component to making estrone. And if you don't have that progesterone to balance, and you're genetically prone to making this sort of toxic estrogen, you feel worse. You tend to not feel so well with just estrogen therapy. So hopefully you're going to find somebody that can help you balance that out. And if not, you always have me.
That's right. I know. I've thought about the telehealth thing and doing that instead, because it definitely is an issue since the hysterectomy. I do have a lot going on in life, but well, sure, I'm definitely irritable, tired, stressed. I'm not seeing results when I go to the gym. And I mean, I do realize you have to be consistent, but I really, prior to the hysterectomy, because my hormones were so out of whack, I actually gained 25 pounds within like a 2 month period. It was really extreme. And I wasn't doing anything differently. And I was having 40-day long periods as well that were very heavy.
Unacceptable.
What stinks about it all is we took care of the one issue, but the weight issue still continues to be problematic 2 years, I think 2 years later.
Yeah. Hormone therapy definitely augments the metabolism. And so without those two hormones working in partnership, then the metabolism suffers. Where does testosterone fit in? As we age naturally, we are losing muscle mass year by year. And so adding that testosterone as a third hormone in conjunction with the estrogen and progesterone really gives people the capacity to build muscle. And it can also help with things like energy level and libido.
Yes. Yes.
Let's see. What makes you finally say, maybe I need to go to a doctor for support?
Well, you've known me almost 40 years, and so I think you know that answer. I have to be probably really sick or really not feel well in order to finally go to the doctor, which is why I did go to my primary a couple of years ago with the hysterectomy. Like, we ran everything, and I went to my gynecologist, and because there were complications, she had me work with an oncologic surgeon rather than just her doing it, because she felt like she wasn't equipped to handle some of the complications we were going to run into.
Understand. Yes, I like to consider myself in your life as maybe like a little thorn in your side that kind of reminds you, like, hey, sometimes I just send you little messages like, hey, how are you? How are you doing? And so for some of us, it does take longer to get to where we're going, maybe out of fear of the unknown, or we think something terrible is going to be wrong. But that kind of goes back to that proactive approach of like, don't be afraid. Like, we're going to find the answer. And that's one thing I like to stress to my patients, like, hey, whatever we find, we're going to deal with it. Okay. We're going to figure it out together.
That's the way I approach real estate. But I think for me, it isn't so much fear. It's more, and I'm shifting, but it's more not taking, everybody else comes first in my life. So, I have a ship to run, I have a business to run, I have a mother to take care of. So it's more about like, I feel like I don't have enough time to take care of me.
You know what's so interesting, Stephanie, is that is a common theme across the board with women. We tend to put ourselves last, myself included. Like, my husband will remind me, like, don't you also need to go to the doctor too to get your checkups? And so, common thing amongst busy moms who also work. So don't be too hard on yourself because you are part of the majority. Absolutely. What do you think the biggest struggle you face is trying to stay healthy?
Probably consistency. And I think what I am, and so I had just started and then we moved into summer, but I had been trying to consistently work in time to go to the gym, and then summer started. And so my schedule has been thrown off a little bit. So consistency in either going to the gym or going for a walk or whatever the case may be, active, because I could sit in front of the computer creating marketing pieces and studying homes and comps 18 hours a day, and I would be happy doing that. And so really scheduling in time to take care of myself consistently is the big issue.
You know, when I see patients, I hear this common theme too. But one of my patients, such a smart lady, told me, you actually have to schedule yourself, like put it on your schedule, just like you do for your meetings with your clients for real estate. And I thought, wow, that really resonates with me. Like, literally put it on your schedule. Like I always tell my husband, I don't have time to check all these emails. Oh my God, I have so many. He's like, Michelle, put it on your schedule. So maybe that's something we could all consider, as a way to make us more successful to complete those things. It's like, this is just like an appointment with one of my big real estate clients. So is my walk at 5:30 when I'm finally done with my day. Put it on your schedule. So anyway, I think you also have some questions for me, Steph.
I do. So, again, I know that your practice before was more as an internist in a hospital. What inspired you to start Vitality MD?
After many years of being a hospital-based physician and always being very busy and very rushed, I sort of transitioned myself to work as a primary care physician in a clinic setting. I love educating people about wellness. And when you have a 20-minute visit to see a patient, review their labs, refill their medications, listen to their concerns, just those three things have already spilled over into 30 to 45 minutes. But there's also a patient right behind them. I realized very quickly that I'm not going to get to accomplish this. I started doing things like printing out, this is the Mediterranean diet, read this, study this, and this is what I think you should be eating based on your labs. And so I just kind of realized, like, I'm not going to be that person to be able to make big changes in this clinic in such a short amount of time that I'm allowed with this patient. And what would happen is my work would spill over to the evening because I would still try, but it wasn't happening. So in this second part of my career, because now I'm, over 20 years as a physician, I decided to open my own clinic, and I love internal medicine. I always had a passion for it, but I decided to do an integrative medicine fellowship to sort of complement my knowledge of chronic disease and be able to present patients with other options as well. So now in my own clinic, my initial consultation is anywhere from an hour to an hour and a half. And I really love and enjoy having that time to take with patients to get to know them. Because if we don't know our patients, if we don't know that person and the details and intimacies of their life, how can we truly help them? So that was really my inspiration.
That's excellent. I really, it's amazing that that's your answer, because one of the things that I could sense when we went to visit your clinic in El Paso was the fact that you do take the time. I think one of the issues that I do see is exactly what you're talking about. I mean, you were in and out with your physician, but what really somehow stood out to me is you take the time to really get to know their situation and isolate the best course of action for them.
Yes, thank you.
Which gets me to the second question, but I think I just answered it for you, which is, how do you think your integrative approach sets you apart?
In my initial history with the patient, I really sort of go down to the fine details of their lives. So beyond getting to know what their medical history is, I want to know who lives in their home. I want to know who their family is. I want to know what they eat for breakfast, lunch, dinner. All these details are important because when we advance to our second visit during the lab review, I have all those important life details of that person to help me formulate a plan for them so that they can ensure success. And even though, yes, everything is moving towards electronic, there's nothing like having a written list of the things that we have to do. And that's what I do for the patients. And so my individual wellness plan kind of sets me apart, I guess, because they leave there with the list with all the important aspects of life, starting with diet, exercise, sleep, what supplements I recommend and why, how many days a week I want them to exercise, what they need to do for their mental and spiritual well-being. So all that is part of my plan and approach to integrative medicine.
I really like that, because you're taking a look at the whole picture.
And it's definitely the benefits to an integrative practitioner is all of that, even things like trauma that we've suffered in life could be holding us back from losing weight, because if we don't deal with past traumas, then your stress hormones like cortisol are surging and the body just holds onto fat. Okay. Even surgeries can be traumatic. Fortunately, some of us, carry traumas from families, things that we had no control over. But all that needs to be processed in order for people to be successful today.
I agree. I agree. Is there, I know you've had a long career, but is there a success story that really stands out for you that you would want to share?
Yeah, I have lots of success stories, but I was thinking of a gentleman in particular. And men tend to be very different from female patients. But when a man makes up his mind to do something, there's no stopping him. You don't hear him say, oh, well, I have these 100 things to do after work. I just don't have time to exercise. So that is one very unique thing in the care of males. They put their mind to it and they do it. But this one particular gentleman came to me very overweight, probably at least 30 to 40 pounds overweight, diabetes, newly diagnosed. And it said, I don't want to live like this anymore. I feel terrible every day. What can we do? And so we initiated the patient on a paleo diet, which is high protein, fresh fruits and vegetables, no dairy, no carbs, no beans. I said, this is not forever, okay? Don't freak out. Because as soon as you try to take carbs away from people, they're like, wait, what are you doing? But he stayed the course. And when we started, the lab test that we used to diagnose diabetes is called a hemoglobin A1C, and he was at a 10. We also started him on one of the GLP-1 agonists. In this case, it was Mounjaro, to help bring his blood sugar and insulin levels down. And we did this for about 4 months, paleo diet, a GLP-1 agonist, and lifestyle change. In other words, I told him, you can't get away from exercise. You've got to incorporate that.
Right.
And in my next visit with him, he had lost 30 pounds.
Wow.
He looked like a different person. And that hemoglobin A1C went from 10 to 6. And he just blew me away. He's like, I'll never go back to that. I'll never go back to feeling the way I have.
Wow.
So it was really, really inspirational. And just recently, I did a follow-up visit with this gentleman, and we're able to take him off the GLP-1. So there's some misconception that once you get onto these medications, you're stuck there forever.
Sure.
But I promise, if you do your part, which is exercise, dietary changes, he was able to come off of it. He no longer needs it. So
that's fantastic. Wow. And so it stayed up. The Mounjaro specifically, because that's a hot topic right now. So
totally.
He is off of that now?
He's off. Yeah.
And he didn't gain weight back?
It's because he changed his diet, and he loved paleo so much, even though I told him, you can start to liberalize now. Let's start to add some complex carbs back. He was like, I don't need it. I'm so happy with paleo. I don't have cravings anymore.
Oh, that's awesome.
I feel great. But the key is that permanent change in lifestyle, with the understanding that everyone goes on vacation, everyone gets invited to parties, birthdays, anniversaries, stuff like that. So you might have a cheat day. But what I tell people is just get back right on. Like as soon as you get back from vacay, get back into your schedule, And if you do, then you have high likelihood to maintain success.
Excellent. So I know you're busy with your practice, but I'm sure you have some downtime. What are some hobbies you enjoy taking part in?
Yes, I am a foodie. I'm a total foodie. I like meal prepping. It sounds crazy. I never thought I would like doing stuff like that. I like doing this with my spouse. You can recall when you came to visit Juan and I, we love to cook together and we love to meal plan together. So that's one thing. I do have a guilty pleasure. I like watching Netflix. I'm totally engrossed in Bridgerton currently. I find that very saucy. And then I also find weightlifting very relaxing. So I do my weightlifting, watch my guilty pleasures on Netflix, and it makes my workouts go by so fast. So sometimes when we're tired after work, you're like, oh, I don't think I can. I encourage people to have workout equipment at home because once I'm home, I don't want to go out anymore. I want to be in my house with my family. So I did create a space for myself to do the things that I love, and weightlifting just makes me feel like kind of just takes my stress away.
Sure, sure. So there's some people, this is a little off, but it's an offshoot of what you're saying. So, do you really think there's an advantage between whether you do it first thing in the morning or in the evening in terms of weightlifting?
Not necessarily. I think you have to find what feels best for you because all of our metabolisms are different, all of the body chemistries are different. And I guess I think exercise is so important that the time of day for me becomes not as important as just do it, whatever works for you. Because some of us need that sleep. Like, I'd hate to tell somebody that loves to sleep in a little, no, you have to get up and do this in the morning because, maybe you'll burn more calories during the day. My goal for people usually is just get them to do it.
I think that's the struggle I have is I am not a morning person. So, but I've been trying to do the workouts in the morning so that I know that they happen, but then I end up hitting snooze a lot. But I'm a night owl and I do belong to a gym that I could really walk to from my house. But if I go at night, I probably won't walk to it. So I can see working out in the evening is probably working out better for me.
I think it's important for all of us to determine what works best for us. And I agree. I prefer working out in the evening simply because I find it relaxing and I think I sleep better that way. But maybe you can walk before it gets dark and have Eric pick you up.
Mm-hmm. Oh, that's true. That's true. So, how does your approach at Vitality differ from conventional medicine?
Being an internist, what I've settled into is finding a blend of both because a lot of times patients will come to me with obesity and high blood pressure. And I certainly am not going to be the integrated practitioner that says, let's get off all medicines and let's treat this naturally, because that's an unrealistic and a dangerous approach. So I think what sets me apart is I find sort of a commonality between the two and realize that, yes, there is a place for conventional treatments. My goal is always to lower patients' risk factors. And so if that means I have to have the blood pressure medication there, that means it has to stay. But what can I do naturally to sort of lower that person's blood pressure without me adding a second or a third blood pressure medicine? And that's where the dietary changes, the weight loss comes in. And then a lot of times I'll have a new patient come to me on one blood pressure medicine, but they're still kind of borderline. And then that's where the natural blood pressure medications or blood pressure supplements would come into play. So maybe a prescription medicine plus magnesium twice daily, or a prescription medicine plus hawthorn, which is nature's natural diuretic. So I find ways to combine both aspects, and that makes people feel very comfortable.
Oh, that's awesome. That's really good. What are some aspects of your weight loss program that people wouldn't find elsewhere, like, say, at one of your competitors?
So I think that at Vitality, we can be a bit of mother hen like approach. And that's how I've always been with my patients, kind of take them in like this, and I'm just going to guard them and help them till they're successful. So you do get a lot of personalized care for the patients that are coming in for weight loss medicines or injections on a weekly basis. They have a nurse to speak with, they have medical assistant always attending to them. And if there's a concern, we tell them, just let the nurse know. The nurse comes directly to me and tells me what's going on so that we can nip side effects in the butt so that they can continue on their journey. Whereas if you go to, more traditional medical practice, you get your script and then we're going to see you in 6 months. It's definitely not the approach we're taking. So I just tell patients up front, you're going to feel like we're in your face a little bit for a while, but that's till we get you on a steady plan to assure your success. So it's for your benefit. And in actuality, our patients get a little spoiled because they love that personal attention and attention to detail. Every time they come in for like a weight check-in, They get their body analytics given to them. And so they learn to be very joyful when they see the change happening. So they can see their muscle masses increasing, the body fat decreasing, and they just get so happy and excited about that. So I think that personalized care is how we set ourselves apart.
I love that. I love personalized care. I think I think it's something that is really lacking. I mean, I do love my Amazon deliveries, but um, I have to say, when it comes to certain services, personalized care and taking that time, I think, is like one of my bedrocks that I believe in. So I love that about your practice. And I could see it when we went to the practice and some folks were there to do things. And I noticed how you were interacting with them, even though they weren't visiting with you. And it just really has a good vibe at your clinic.
Thank you so much. And trust me, I've already told you, if there comes a time when I buy a house in San Antonio, which was always my goal for us to grow old together, you're going to be the person I call.
Well, thank you. I'm hoping if we just get a pod for the five of us, like a compound where we can all have our own little house.
Sounds like a plan. As long as there's water close by.
No joke, no joke.
Well, I hope you enjoyed our episode. It was truly my great pleasure to spend this time with Stephanie. Again, an amazing realtor in San Antonio, my number one choice for sure. Steffi, any final words?
I just appreciate the time we had to spend learning about our businesses. I think even though they're entirely different industries, our approach to how we interact with the people we work with is very similar. I know one of the things I've talked about before on my social media is I'm not a turn and burn producer. Like, I'm not going to be the top producer because I want to be sure that all of my clients' needs are taken care of. And I think that's really one of the things that draws me to your business so much, as well as your approach. While it's a totally different industry, is the same. So
I
I
agree with
love
that.
And I enjoy this time we've had together. We may have to have coffee talk or wine talk or something.
Totally. The only thing missing that we normally have at this hour of the day would be some mimosas, but maybe next time.
Maybe next time. All right.
Thanks, babe.
Thank you.
Only one question that I think got bypassed that might be useful information is how the bioidentical hormones are different from conventional hormone treatments. Many of the gynecologists go with the more traditional conventional treatments, but a lot of times what I hear from patients is they develop a lot more side effects, like something just doesn't be right. And kind of like what we alluded to early in our episode is maybe they are producing too much of the bad estrogen in response to the synthetic hormones. So bioidentical hormones are made by specialty pharmacies called compound pharmacists, and every city has them. It's pretty amazing. But they take plant sterols and they make the hormones because plants have hormones. So you can compound anything from a plant, and that's going to be a more natural fit to the human receptor is what a plant produces. So my best analogy, and I tell this to men and women alike, and they all giggle, is think about Cinderella with her glass slipper. Okay. It's a perfect fit. Okay. The stepsister represents the conventional hormone therapy, and we can get that foot to go into the glass slipper, but it's not going all the way. And that extra foot piece represents side effects that might happen from synthetic hormones. So that's my best way to explain the difference, is just a much more natural feel with the bioidentical hormone therapy.